Donna Grindle is the founder and CEO of Cardon. Her and her team focus entirely on helping businesses develop and maintain their HIPAA compliance. She is a consultant, subject matter expert, trainer, speaker, podcaster, blogger, and all-around brainiac nerd. Guys, please welcome Donna, self-imposed nerd. Hi, Donna. How are you?
I am doing great. I soon will be, even better when we can get out and visit with people. As we all know, it's well worth it.
That's
All
right.
right, let me just get my nice screen there. You guys seeing the screen? There we go. All right.
Yeah.
Well, I hope everybody's doing well. I have asthma, so I started social distancing well before everybody else because I'm a nerd, as I said. But I'm happy to be here and looking forward to hopefully answering a lot of questions, because there has been a lot of confusion just because there's so much information coming at us at a rapid pace. So why don't we get started? Well, that's me. There's my picture. Hey, how you doing? If you have questions, don't hesitate to ask. We do a weekly podcast, Help Me with HIPAA. Guess what we talk about? You can see the information. You can go to the website. You can listen on the website, listen to your favorite podcasting app. Some people even now are calling it an audiobook. I don't know. It's where HIPAA and humor collide to make learning fun. Have fun with that. It's free. And if you're unhappy, double your money back. Okay, first of all, question number one, has HIPAA been waived? No. And I've gotten questions on Twitter and all over the place of, has HIPAA been waived? Did I hear this right? So on and so forth. What they have done is trigger things that are built into HIPAA to allow us to manage the crisis. And there are things that are public emergency built in. This stops when there's a public emergency to make care faster, and also their ability to issue an enforcement discretion, which just says, look, if you're trying your best, we're not going to, come down on you with a big boom. And let's look at all the different things that they've released. So first, most people didn't notice, but they let's see, February 3rd, they first issued a bulletin that mentioned the novel coronavirus before it had the name COVID19, but it was reiterating the privacy rules for HIPAA in it. Well, it's all built in, and what everyone should know that you can do in an emergency was being reiterated. First of all, you can share with public health officials. That's necessary specifically in this kind of an environment, but it's balanced to ensure that appropriate uses and disclosures still are made when it's necessary to treat the patient, and balance that whole public health need of understanding, so that if you do have a coronavirus patient, you can report it to public health. Now, at the time, we didn't have the onslaught of reports that we do right now, depending on what part of the country you're in. But these were nothing really changed. They were just notifying everybody and reminding everybody what the HIPAA rules were. And when you get the deck, you'll have a link. You can go to all these announcements and get the detailed text. Help yourself. The next thing that came out was the limited waiver of HIPAA sanctions and penalties during the nationwide public health emergency. I always love how the names of these things make you want to just get confused right off the top. But this is the part that's built in. Once a public emergency, whether it's a hurricane, a tornado, or a virus outbreak, once there's a public emergency declared at the federal level, then they do this automatically in that region. HHS then triggers this piece that's built into HIPAA that says we can reduce paperwork and do this to facilitate care, just because we know the volume's going to be high, there's going to be limited staff potentially, we're going to be not necessarily in our normal environment. So let's do everything we can to make this better and faster. So what that does is that obtain a patient's right to speak with family members or friends involved in their care. If you have someone that brings someone to the hospital, clearly they're involved in their care somehow. And if they're trying to talk to you and get information, you are able to go ahead and do that because it's in the best interest of the patient. Again, this is more about taking care of people than it is worrying about trying to, oh, I can't do this because of HIPAA, I can't do that because of HIPAA. We've had those problems before. But if it is important to note that if a patient has specifically in your records previously said, don't tell my mother nothing, and the mother shows up, you still shouldn't tell them. And there is that tricky piece, but that generally comes into play when it's an individual provider's office, not the emergency room, right? It would be something that you had on record.
So Donna, so say that happens and you have somewhere in paperwork that says don't tell mama anything, and then but she's there, it's a huge emergency. You're talking, are there the way that they've opened up the regulations, is there things that are forgiven, or is that, how long and how do you dance around that?
Yeah. Well, it only applies if you already have it in your records. So first of all, in most emergency cases, those are at the hospital, they wouldn't have that in their records. But if you're at the doctor's office, then you've got to do what's right to treat the patient and do what's in the best interest of the patient. If this person is, high fever, they don't know anything, they don't want to talk to the mother to know everything, but the mom is there, talk to the mom about this particular case. If they have other conditions, don't bring those up, but deal with this particular scenario, which is very specific to coronavirus. But in most cases, there's that one caveat, and I try to make sure that everybody understands it so that the mother doesn't call up a doctor's office and say, hey, I want to know if my son has been to see you for coronavirus, and it's already in your records. It doesn't mean you can just talk about it. Does that make sense?
Right. Yeah, and then so you're talking about confidential communications, you're on these telehealth calls all of a sudden where, who's listening? How do you know?
Yeah.
I mean, you can't really,
we'll hit that in just a minute
handle that
when we get to the telehealth part, because it's a big chunk of everything that's going on.
Yeah. Okay.
The other thing is you don't have to honor the request to be opt out of the facility directory. Nobody has time to do that. That deals with hospital facilities. You don't have to distribute a notice of privacy practices and get people to sign off on it. If the patient has privacy restrictions, there's some certain rights to privacy restrictions where they can go well above it. If they start asking for a lot of stuff right now, you can't deal with it right now. And the same thing for confidential communications. And most of that has to do with, I've got to make decisions in an emergent situation that are above and beyond normal care. Now, keep in mind, this is mostly dealing with the public emergency. If you're trying to do business as normal and using telehealth, you've got some similar issues there. It doesn't mean everything got thrown out the window if you can't just decide, I'm not going to do these because this public health thing, but I don't have anything to do with the public health. I'm not even talking to my patients about it. So keep that in mind, because it's not the OCR you're going to worry about. It's your patients coming back and saying, why'd you do that? which gets us to the telehealth enforcement discretion release. And they even had to come back later because this was so confusing, and they did a FAQ and FAQ release specifically about telehealth. But here's the bottom line. It says, if you are making a good faith effort to treat a patient using telehealth, and you are in a situation where you need to use some of these applications that aren't necessarily approved for HIPAA, you don't have a business associate agreement in place with the vendor, we will overlook that. We will keep that in mind. Let's say we'll use our discretion to not punish you for having to do that. Does that work? I'm trying to say it in a way that's not legalese, but the bottom line is it's saying, look, if you are using something that doesn't have a BAA in place, we will overlook that lack of a BAA in order to allow you to do what's right to treat the patients, because patient care comes first. And often people forget that when it comes to HIPAA guidelines. Is the bottom line is patient care comes first. Can I make a reasonable explanation for any decisions I do or actions I take or don't take because I felt it was in the best interest of the patient? That's what it's all about. So go ahead.
I know they said there's some that are not allowed. There are certain ones that are just too public facing.
Right. So like Facebook Live, the ones where people are out there recording videos and letting everybody see it, it's public facing.
Some of the Twitter applications. Yeah.
So if it's public facing, you can't have a private room discussion.
Turn yourself into a potato.
Yeah. God, I have not stopped laughing about that potato. But every time I see it, I just start laughing again. But you can use Skype, Google Hangouts, Zoom, FaceTime, those things where I can have a private conversation, but I do not have a business associate agreement in place. And that's the key difference. What they're doing is saying, we're going to ignore the fact that you can't get a business associate agreement that quickly, or that app doesn't offer one, but I've got to use this because it's all I have available. And so our recommendations have been that you use an app that you can have a BAA with is your first objective. And that has to do with making sure that long-term, do you know it's secure? Do you know who's listening? Do you know all of those things? Again, mean OCR may not come down on you for not having a BAA, but if you have problems with this stuff and information gets out that your patients don't want, you're still going to have problems with your patients. And even like the med mal carriers have brought that up, along with what we're saying is privacy and security is a thing that patients do take seriously in their healthcare. Surprisingly, the people that, I'll just share everything, but you start asking them some specific questions about their health. Would you like this broadcast on the internet? Oh, no, do not share that. So it does give us flexibility. And we've had some interesting conversations where I've had I've had clients say, look, I've got this patient and they have a flip phone. What am I going to do? I call them. I got nothing. It's like, have them get their grandchildren or a neighbor to help. It's all we've got in those cases. And there's other cases where they have the smartphone, but all they know how to do is answer a FaceTime call. Okay, great. Call them on FaceTime. Do what you have to do in those situations. But by default, use a app that meets those requirements. And we've had tons of groups that implemented Doxy.me is like in 2 days. they went from we've got nothing to they've implemented Doxy.me, both the paid and the free version of that. And there are other apps out there that you can do that with. So for example, if you're a company that uses a certain version of Microsoft Office 365, then you have the ability, they will sign a BAA and allow you to do Microsoft Teams conversations. If you're a G Suite company and you've set up the BAA, then you can use Google Meet. And those are already built in. You could do that anytime if you've got those BAAs in place and you have the right version, of course, of their application. Zoom is a big thing. It's gotten it's been beaten up really hard because it was becoming like a new standard. First the nerds started using it, then everybody else, it's the way it always works, right?
Yeah.
And so we've been using it for a while, but one of the things that we run into is people start using these apps, and the first thing I do, because I'm paranoid, that's my job. When I use a new app, the first thing I do is go look at the security settings. Because the vendors make it easy by default, not secure by default. And that goes no matter who you're working with, no matter what the app is, you have to watch for it to be easy by default, not secure by default. Because, security is not convenient, which means often that's not easy.
So the ones that are like Doctors on Demand, Teladoc, Amwell, those are all more secure.
Right. Well,
So why
the key element is
open it up to Zoom and things like that? Why didn't we just
because some people don't have the capability technically to do it. They just don't have a lot of that capability in place. They're not very prepared. They had no intention in hey, let's implement in March 2020, we're going to implement telehealth. That's not on anybody's plan, right? It just became part of their plan, and they're trying to care for their patients the best they can while following social distancing, protecting their staff, protecting the patients, and particularly those in the high risk categories. Those Medicare patients, you have to monitor them. You need to check on them. You need to talk to them. And they have a certain amount of capability, many of them. I mean, my 91-year-old father-in-law has an iPad and an iPhone. Granted, I support it. But he can do telehealth if he needs to. We can connect him up. And many, my mother has an iPhone. We can do that, maybe. But many of the folks that are on Medicare need this more than anything, and they have to stay at home. So that's why they started opening it up to things where I can't get a BAA. Really, it was not about it's not secure. It was more about I can't get a BAA. And so a lot of the questions that people have and a lot of the things keep going back to Zoom because everybody jumped on it first. So first, let's talk about how Zoom, their options. So Zoom has the free option that, if you're using free, you get what you pay for. Okay. When it comes to security, there's some, but you're probably not using any of the security settings because there's you're just using free. You're not understanding those. Then you have the Zoom Pro, and the Zoom Pro is a paid plan that many of us are on. We've been on it for some time. And then you have Zoom for Healthcare. And Zoom for Healthcare is where they will sign a BAA. And if they sign a BAA, then they're obligated to follow HIPAA, right? So Zoom for Healthcare covers you because they're separate and equally liable. All the others, they're not liable, only you are. So there's the big line with using the ones that don't sign a BAA. That's the key difference. They could both have security problems, but if one signs a BAA and the other doesn't, then the one that did sign it is separate and equally liable. they take on the liability of selling you something that they committed contractually to protect, and they didn't do it. Whereas the other way, without the BAA, you're taking on that liability because they're not committing to doing it.
Gotcha.
So if you do want a BAA with Zoom, you have to sign up for their healthcare plan. That's the only one that they'll sign it with, and they put you on different servers, they manage it differently. If you want to use the Pro version, the thing that you need to do is use the proper security. One thing that you do is make sure that you they've now changed the app, which drove me crazy because they changed all the settings to make it secure now as a default, or make it more secure, because we all know nothing's perfect. But they changed it so that it requires a password. When you start a meeting, you have to know a password. And I think they turned on the waiting room, but to me, the most important thing is turn on the waiting room, which says if someone's coming to the meeting, they're going to be sitting at a screen that says, my screen says, oh, Cardin will be here in a minute. We'll let you in. But that keeps other people, the interlopers, if you will, from just finding the code, because that Zoom bombing is happening because they set up an app that just scans for the codes. And those are 6-digit numbers, 9-digit numbers, right? So they scan for that number and then ping it and see if they can open up and get in a meeting.
Well, I think people are seeing a lot of that on the news. There's this dark web grabbing of the meeting numbers, and it's scary.
It's not even dark web. It's a bunch of kids, and then and all of a sudden there's somebody's armpit. Well, it's a really mature individual, right? But they're bored.
It's important.
Pardon?
It's important still.
That's why we say use the waiting room, because it keeps anybody from coming in.
Right.
And particularly in, small meetings, it's easy to manage. One this large, it gets a little harder, because what happens is the host will get notification that somebody's in the meeting room, and then they choose to allow them to come into the meeting. And you can't get into the meeting without the host approval. So that stops a lot of the interloper madness and the Zoom bombing. But you could take it another approach and even do both, that not only do I have to authorize them to come in, but then they have to have the password to get in. And then some people said, oh, well, the password is getting sent in the email. Well, that's not how they're attacking people anyway. They're scanning for it, so they're not hacking somebody's email. That's why that's okay. But you can have the password and the meeting room. You can do only the meeting room, or you can do only the password. But all of those solutions will prevent the Zoom bombing. And those settings were there always. It's just they weren't turned on by default. And they did make some changes to the app of how you could do things with it. But again, that's primarily with the Pro version. And the free version, you're using the free stuff, and they're trying to give you the free stuff so that you'll eventually buy the stuff.
Right.
And the big difference that everyone needs to understand is that there is a very specific line, and it gets down to, will they sign a BAA or not? That's what the enforcement discretion is about. It is not, oh, it doesn't have to be secure. What it says is, we're not going to blame you if it's not secure. But if you knowingly are using things and doing things and not even trying, your patients are the ones that you got to worry about. Again, it's the OCR enforcement requirements right now. Let's put it into perspective here. OCR has announced since 2012 less than 100 enforcement actions. Actually, I think it's like 67, 70, a really low number. So it's very statistically unlikely that you're going to have an enforcement action. And then on top of that, they've now said we'll use discretion and not really get you, so to speak, if you don't have a BAA in place. That being said, then, that's not your concern. Your concern is your patients dealing with it
Right.
and them having a problem. And yes, there are a lot of issues and concerns. Now, Zoom they're trying to recover because this was their moment to shine. And the CEO has like stopped all development. They're not working on anything but privacy and security, which is probably too little too late because now they got a black eye they'll never get rid of. Their issues were primarily ones that were coming into play when people weren't using the settings and they were just, using the free stuff. Yes, there's still other problems. And yes, they do some stuff in the background. All of them are, caught on doing the stuff in the background. But, and I'm sorry, I'm trying to watch the questions pop up and see if I can keep up with it. But the statistic on the enforcement, if you go back and look, since 2012, the announcements of either fines, penalties, settlements, those kind of things, there's only been about 67. I know it's less than 100. I think the number's 67. I don't remember how exact I am, but it's somewhere around 70, give or take. I'm going to go with 67. I've rolled my dice. I'm picking that number. It's final answer. But that there's and so then the next question is, I don't think I understand that. There are certainly lots of fines that have been imposed. The HIPAA wall of shame is full. So the HIPAA wall of shame is full of data breaches over 500 or more patients. Yes, that's full. Anybody on there will be investigated by the Office for Civil Rights. Yes, they will have an investigation. They will launch an investigation for that. They'll launch an investigation if a patient or somebody makes a complaint. Often it'll be disgruntled employees will file a complaint and an OCR will look into it. And then they will also look into it if you make the news in a very unfashionable way. They pay attention, they watch the news. But those are the ways they start an investigation. The issue is they do thousands and thousands of investigations. But if you go look at how many times they make an announcement per year, I think the biggest year was maybe 12, that maybe one a month. I don't even know if it was that many, that they actually announced that they had done enforcement action, which is the civil money penalties, or they had done a settlement to prevent the enforcement action. And those are the only ones, and you can find those on their website, the OCR website, at the, I think it says enforcement activity is where it's at. And we can track that down. But that is the difference between the investigations. They're doing tons of investigations, but they have made it clear for years that their objective is compliance. They don't want to fine people. They want people to get in line. And that's why you have most of these settlements where you pay a certain amount of money, but you're also on a 2-year corrective action plan. Some have even been put on a 3-year corrective action plan. And when you are on those, that's when OCR is overseeing your program. And they're monitoring everything that's happening. And you have to send reports and you have to do a whole lot of other stuff. So that's the difference in enforcement activity, enforcement action being taken, and investigations. So that shows you the statistical likelihood is, oh, am I messing up my screen? The statistical likelihood of anything happening is very, very low as far as OCR coming down on you, especially right now. It normally is.
Right.
The statistical likelihood of you being caught up in an investigation for 3 or 4 years, high. And that's expensive. And the statistical likelihood of your patients having a problem with it and suing you, Also very likely when these things occur. And that's what you want to worry about when it comes to HIPAA, is if I'm following the rules, then I can make that argument either with the OCR or in court. That's it.
Right.
That's my most important thing. Can I make this argument this is reasonable and appropriate, and that patient care was my number one priority?
So all in all, would you, even though they have somewhat of a black eye, you would recommend Zoom over, say, FaceTime and some of these other applications, because they are working on privacy and they do have the Zoom for healthcare possibility and all that?
Yeah, if you're going to use the proper security, even on the non-BAA things, it's fine.
Yeah.
I'm just saying, if you're going to do in good faith, use a tool that you can't get a BAA, then you're fine. But make sure it's not, hey, we have this one that's secure that we have a BAA, but we don't like using it, so we're going to use one of the free ones right now because we don't have to do it. Now, I can't make that argument for you in court if that comes up. You see, there's not a good faith scenario there when I look at that and I see that there's a certain amount of capability that's there, but you choose not to do it because you don't have to. That's a different scenario. The most important thing is patient care. And if I can do it with a BAA, then I'm protecting everybody. If I have to do it outside that, then make sure that I understand how it's secured and that I'm using it properly. Now, whether that's, Google Hangouts, I think they said they're adding like 2 million users a day. That's another tool you can use. You can use Skype. You can use, and I think Microsoft is allowing people to use Skype for Business, which is a competitor, obviously, for Zoom. But if you're going to use any tool and use it responsibly, it should be fine right now. But I would recommend that you use the tools where you can get that BAA if possible.
Got it.
All right. So, and then there's, we're going to go on and then we'll catch some of these others because there's a lot of things coming in. If I've missed any, just pop it back in there or I haven't touched on it. They then released on March 24th the COVID-19 HIPAA disclosures to law enforcement, paramedics, first responders, public health authority. Again, this is more or less a reiteration of what HIPAA says you can do. And you can share information with law enforcement, paramedics, first responders, public health. That's built in. The difference is you don't make public statements and you only say the minimum necessary. You don't just go start saying, here's my list of patients that have been diagnosed with COVID-19. Unfortunately, there's so much confusion and HIPAA's being thrown around a lot. I saw an article in a Boston paper, I want to say, that it was an op-ed somebody wrote telling people they need to opt out of HIPAA. HIPAA is not designed for this. And when you read it, they think that individuals are bound by HIPAA. And it's not. At first, I'm reading it thinking they want doctors to just post out on the front page whoever but no, they think individuals have to opt out. And I'm like, this is not even an individual issue. There are people that are that confused. So we have to go above and beyond to make sure people understand what you're trying to do. And in this case, again, it doesn't change HIPAA. Nothing's changed other than it's reminding you what you can do within reason. And not making a public statement, we would all recommend that in a normal environment. You don't go out and make a public statement. And there are cases where patients, they'll get in the news and they'll say the doctor did da-da-da, or they'll put it on Yelp. If they do that, that's on them. You can't respond to that. And there's multiple cases where that's come up and enforcement was done because the organization that the patient was yelling about or whatever came back and said, hey, here you go. This is what really happened in our opinion, and we're defending ourselves. No, it's not a thing, but it is the best thing. And
I mean, I think it's fair to say there's a lot of misinformation and confusion out there as it is. So
right.
if it would be helpful if it were more clear for everyone. It's very confusing.
Well, and a lot of that has to do with people don't understand it in the first place. And that's why we have Help Me with HIPAA. But and I get out and I answer questions on Quora, which is a Q&A answer site. I'm out there trying to explain to people what their options are, what they can and cannot do. Our clients are sending us stuff in and saying, okay, we think this happened and somebody made a mistake. And that the, let's see, how was it? That a patient tested positive and the providers that were dealing with that patient then isolated, did what they're supposed to do. But some of the staff members told patients that they were rescheduling their appointments because the doctors had been exposed. Okay, that's technically, they did the test themselves on themselves. So that means they're being treated at their own facility, which means they're covered under HIPAA too. And you shouldn't be out talking about patients and telling who's been exposed, no matter who it is, not to general people, unless it's necessary for public health. So that, I had to explain to them, you can't do that. But here's another one that they just came out with recently on April 2nd, saying that this one is that unless a business associate agreement specifically says that this business associate is authorized to notify public health of these things and other entities without that express permission in the BAA, they're not allowed to do it. Well, obviously, there is a boatload of work that needs to be done to notify the right people, keep the numbers, all of those kind of things. This waiver allows them to not have to update their BAA to allow a BA to do it. That's all that was saying. And boy, did it create some confusion, because then it's like, so you don't have to have a BAA? No. BA can do what, no. It is, if you want your business associate to assist you in making notifications to public health and sharing information to the other entities where they're supposed to, and it's not in their business associate agreement, then we can allow them to do it without updating the business associate agreement. That's what that last waiver was about. And then there was another notice that just came out over the weekend. I forgot to put one in here, that there are people calling up offices, calling up providers, and saying that they are with the OCR and asking for patient information. Apparently it's happened more than once, and people fell for it. But here's the bottom line. If you get one of those calls, you ask them to provide the original investigation paperwork, because OCR will never just call you up and ask for PHI. It's kind of like the bank will never call you up and ask for your PIN. OCR is not going to just call you up and ask for PHI. Same thing. So if you have that, though, notify OCR if somebody's doing it. Try to get them to give you contact information. Let me call you back. Do you have a number I can call you back? Something like that, so that you can notify OCR and let them know. But please do not, make sure your staff knows. Anybody that gets the phone call that it's OCR investigator wanting PHI, no is the big answer. Nay, I say.
You could see that happening. I mean, just even getting on, say, telehealth, one of my first questions would be, have you had any positive cases? How many positive cases have you had? How are you doing? Everyone wants to know. Yeah. And it's not necessarily their business.
Exactly. So it's a tough thing in healthcare, because we do, and I've worked in healthcare for over 30 years, so I get it. And being part of healthcare, you see things differently. that you understand the systems and you have to work together. But we also have to worry about protecting privacy in this situation, because there's going to be a lot on the back end that we're also going to have to worry about. So let's don't mess it up now. Here is the next thing. How long are these effective? So technically it was like 72 hours from the public emergency, unless it was, but the bottom line is, when they say that the public emergency declaration has been lifted, you have to assume that this stuff is no longer in play and everybody gets back in line. But you'll probably see announcements about that all of this is getting kicked off. Just know that when you hear the public emergency declaration has been lifted, you should be aware that that means this stuff is going to go away, as far as all these special leniency and changes there. All right. So what should we worry about now? Right now. Right now, you have the issue of making sure that HIPAA is still being followed. And as you mentioned in the opening, somebody's still got to worry about this stuff, because patients do have a right to privacy. And even though everything is different, that is not different. That itself has not changed. We still should have the right to privacy about what we choose to share and who we choose to share it with about our health care. With that in mind, there's so many things that everybody's having to adapt. And, now I can't wait until this all calms down to maybe sometime next year, and I get to have a meeting with somebody telling them how they really need to have a written plan, incident response, business continuity, that has nothing to do with doing your backup. And it's all about how you would function if everything was turned on its head. And everybody blew me off before and said, that's not going to happen. I'm not going to have that problem anymore.
No.
And so what I encourage people to do is, knowing that many people may not have these things done in writing in the first place, or they may be very minimal, write down what's happening now. Write down what's working. Write down what policies and procedures you have put in place. Write down what you've changed, because at some point you either may need to undo them, you need to be able to put them in your incident response business continuity plan, or you may want to incorporate them in your new way of operating. And you don't know until all of this is over and we do, that post-incident review. It seems not appropriate with healthcare to ever call it a post-mortem, but that's what a lot of other industries do. But more or less, there is today in healthcare, everybody's implemented a business continuity plan of some sort, whether they had one or not. And that's a very important thing, that if you take the time now and make notes, write down, and you don't have to write a dissertation. I'm talking about bullets. This is working, this isn't working, we got to find a better way, build a plan for this, change this policy, anything, so that you learn from this going forward and it doesn't just go away.
Yeah, that's a great idea, Donna. So like if you have a team and they're all on different telehealth meetings, or they come, they're meeting up with other healthcare workers, maybe at the end of the day, or you have a quick meeting, wrap up, and say, okay, what happened that we didn't expect today? What can we do better tomorrow?
Yes, and that is part of a normal incident response business continuity stance, that you have to have a team that's monitoring these. And this is the reason that even a small provider office, we have single providers that are, coming to us and saying, what do I do? And we've done everything we can to help people, whether they're our clients or not. Fortunately, our clients were well ahead of the curve And we were planning with them back in February. What are we going to do? How are we going to handle this? So that when things hit in March, they already had a framework in place for a vast majority of them. And we had to start, okay, we're going to have to move the timeline. We're going to have to do this, do that. That was a very helpful thing, because then we were able to help people who weren't our clients and try to get them up and running in some manner. But that's where we are today. And everybody do your best to make those notes, because you've got a perfect opportunity to save you time later. Go ahead and do it, because ain't nobody gonna have time once this is over. Which gets me to the what should we do, because we have to reboot our businesses. This is going to be so confusing. And that gets back to making sure that you do all of these things. And another thing is, in a crisis, your leaders bubble to the top. They always do. And you will have people that you thought were leaders that didn't show up, and people you had no idea their capabilities as a leader who says, what about this? How do we do this? And some of those people are going to be irritating when you're in that crisis, but it's clear that they want to participate. Put them on the team. And then another big problem, and we've talked about this over and over, is people are looking at records and they're trying desperately to get to information they shouldn't. There's going to be a lot of snooping going on. We know that's happening. It happens on a normal basis. It will really happen now. Have a plan for how you're going to audit what's occurred. And we're doing more and more on that auditing, because that problem's getting worse. It's not getting better in healthcare, which is unfortunate, because we see all these other things getting better, but people doing improper access to records is getting worse, and this is not going to make it any better. So have a plan in place on how you're going to deal with the snooping. How can you audit the records if you have a tool that can do it, and reports and those kind of things. There's a lot of different ways you can do that, but start thinking about these things now and implementing the things that did work so that you're more efficient, because this does force you into efficiencies. But keep in mind, you've got to reverse a lot of these things and get people out of bad habits, which is another reason we don't recommend using the things that don't have a BAA, because they're going to be in the habit of doing it.
Right. So we have a question over here that says that they heard that Zoom feels that they say they can use the recordings as they deem fit. Have you heard anything about that, Donna?
Now, if you record to the cloud, then it's stored on their systems, and I don't know that I've ever seen that. I mean, it may be buried in some contract somewhere, but do I think that they're going to start doing what Amazon does with Alexa? No. And the bigger issue to me is always worrying about where's that data going, and because we're not required to have a BAA, then that's concerning. But they do give you the ability to record to your own computer, which is what we always do. We never record to the cloud. So they, that we download it and they have it, but they're supposed to delete it. I don't have any evidence of them doing anything that where they're doing the kinds of things that we hear about with Alexa and Google Home and Siri and those kind of things.
Right. So, but say with Google Hangouts, you would, if you recorded it, you would keep it out.
Yeah, I prefer, now if you're using, again, this gets back to, is the BAA in place?
Right. Well,
if there's no BAA in place, they have no obligation whatsoever at all. So it doesn't matter. They have no obligation built in to protect your privacy without that BAA. And, there's a big question for a lot of people on whether or not do we record and store it on a patient's record. Well, you know what? You don't record their office visits. So,
Right.
you know,
Why
you're not,
record it?
yeah, it's not like you're recording a normal office visit. Now, if you do record a normal office visit, then yeah, maybe you want to, but I mean, that, I don't know anybody that does that. And to me, it's probably not
Necessary.
recommended unless you're concerned about something, which, we all know how that goes. But overall, as a standard practice, I don't do it in the office, and all this telemedicine is supposed to allow me to do that remotely. And, I don't record my meetings, by default, because I would forget to turn it off. I would rather forget to turn it on than forget to turn it off. And so, like in
Right.
this kind of meeting, yeah, we make sure somebody records it, but otherwise, I don't want it to be the default. Turn it off. So,
Yeah,
yes,
that makes sense. I could
can't
see, I
even
guess,
keep.
someone wanting to record. I could see someone wanting to record it just to make sure they're safe, but then that sort of negates the whole thing because now you're making a copy of something unnecessary and putting it on a cloud.
Yeah, and putting it out there so that now, because here's the other thing, if you don't have a BAA with whatever service you're using, and you don't record it and give it to them, but you record it and give it to you, you're still responsible for HIPAA. So wherever that thing goes, you're responsible for the security of it. Yet another reason not to do it. And another thing that is the option is turn off the option to allow the guest to record it, because you don't want them recording it necessarily, just like, unless you allow people to come in and record their office appointments.
Yeah, that makes sense. A lot
Mm-hmm.
of stuff we didn't even realize was going on. I didn't know they could record it.
Yeah, it depends on what you're using and what the tools are. But yes, the other side, if you will, has the option to record it in some scenarios. So you want to make sure you understand. And that's why I say you don't just start using things. I mean, you do that initial test, but then you study and make sure you understand what you're opening yourself up to if you use these tools. Like last night, I got a thing from one of my good friends that, they work in the school system. Hey, let's do this app. It's a, I don't know, party thing where everybody, and I'm like, yeah, I'm not loading that app. I don't know it. I got to look it up. I'll get back to you. But that is because I understand what's really happening out there. And the criminals see this as a gold mine.
Right. I'm sure they feel like we're all unaware.
Yes.
And
So
panicked.
there's a lot of things that we have to do, and I can't even keep up with those questions that are coming in. So I'll have to default to you guys. But I will tell you that patients often don't understand security and privacy. And if they just insist on doing it not secure, then just make note of that you tried to talk them out of it, and you explain to them that this is not secure and that I can't guarantee your privacy. Make a note that happened. Now do it at the time, date, time, yada, yada, yada. Don't backpedal on those. That always gets you in trouble. It's like the people that call me and say, hey, can you do me a risk analysis for 2017? No, I can't. That is a moment in time documentation that you should have in your patient records.
So we have a question come in that said, do you have any thoughts on the release of information when the client cannot come into the office? Example, verbal consent after explaining the whole release to them.
Yeah, I make note of it just the same way.
Yeah.
Anything that you're having to do with the patients where you're having a conversation with them and you can't get paperwork right now, and there's so many ways that you can't get paperwork, make good notes. Just put it into your, whatever your systems are for notes about the patient. You know, most of the EHRs, and even if you don't use an EHR, I know some people don't, you can still put that in with your billing documentation. Document somewhere, you had this conversation, this is what was said, this is what they elected to do, you told them it wasn't the way to go, or I got their consent verbally, I read this to them, and that's why we tell people get a script so that I can say I read script number 32 and they okayed it.
Right.
Then you can't say, you know, oh, you didn't tell me that part, because I don't have to remember it. I'm going to read that script every time so I don't screw it up.
And one of our folks here, Dave, is asking regarding emails, like to dig into emails a little. Is if we have a client sign a waiver, can we send unencrypted emails and still be in compliance?
At any time, you can send an unencrypted email to a patient if the patient says they want it that way. Now, if you're telling them that's the only way they can get it, that's a different story. You can't make them do it unencrypted. And of course, at this time, we may be forced to do that, but you need to say, this is not going to meet privacy and security requirements, but I can do it. Are you okay with that? And again, you document the conversation. Same thing. Every way. Document the conversation. If it's some sort of authorization, use a script so that you can say, I used the script, they okayed it, then you know what was said. But you have to commit to reading the script and not trying to remember it.
Well, this is awesome, Donna. Thank you so much for joining us today. I know there's some more questions that we haven't gotten to. We are going to have Donna answer them, and we're going to send out an email here at the end. We just appreciate all of you coming today, and especially Donna during this complicated and critical time in healthcare. I mean, it has been very confusing, and I hope we have, and Donna has answered some of your questions and made things a little bit more clear. Again, you're going to receive a recorded version of this learning lunch and a follow-up email that will also have a link, incidentally, to our very popular accredited infection prevention training with that critical COVID-19 module. It is free until the end of the month, so you can take advantage of that. You can share it with everyone that you think needs it. It's open and free to share. And we will be posting more free live learning lunches coming up. You can find info on these at 4medworkshops.com. There are also previous recorded lunch and learns there on a multitude of subjects. Please check them out. You can also check out our complete training catalog for unlimited amounts of learning at 4medtrainingcatalog.com. Thank you all so much for joining us. Please stay healthy out there and stay safe. We really appreciate you joining us, and we hope to see you again soon.
Thank you.
Thank you, Donna.